what is a CT scan? So CT scan is a 3D scan of the body or of part of the body. CT stands for computed tomography. Tomography means using slices. So in a CT scan, many images are taken, many slices are taken of the body or part of the body, and then these are put together to make a 3D image. So CT scans use X-rays, so using radiation, ionizing radiation. The amount of radiation used in CT scans is not a lot now, so they are relatively safe. CT scans can be of two forms. One is just a CT scan, and the other form is sometimes called an enhanced CT scan or a CT scan with contrast medium. And when you have that CT scan, you're given a dye essentially intravenously. So when you go for your CT scan, you lie on the table and drip will be fitted, or it's something more like a kind of a syringe, sometimes robotically done. I mean, the syringe is robotically injected, and you'll have some images taken, and then the radiographer will say, we're now going to put in the contrast medium, and they'll either come and do it or they'll press a button and this stuff will be injected into you. It's a very strange feeling because your body kind of becomes warm as it flows throughout your body. And that contrast medium just enhances the contrast on the scan, meaning in the context of cancer, meaning that it's easier for or clearer for the radiographer to better say what tissue is healthy tissue and what tissue is diseased tissue. CT scans, I think, are very useful for seeing if something is bigger than it should be. So it's also good at recognizing or kind of showing structures between organs. So like when you can sort of see cancer growing between organs and things like that. So yeah, CT scans are kind of like this I don't want to say standard, but they're the regular scans generally cancer patients can have every 3 months. One thing I should say about the contrast medium is that it can potentially damage the kidneys. As far as I can tell, the only kind of known cases where it's caused kidney damage are for people who have kidney issues. That's why it's really important. You'll be asked, like, do you have kidney issues? And if you do, make it very clear that you do, because they'll then not use the contrast medium, or I'm not sure if they can use less or something like that, but it's really important to say if you have kidney issues. Kidney damage is extremely serious because it can't be repaired. So that's a reason why some doctors favour different kinds of scans like PET scans. So that's what a CT scan is. I've had loads and loads and loads and loads. Pretty straightforward. I have full body CT scans because my cancer is stage 4, which means it's spread to other places. Really important to look at the whole body and check that no new tumours have appeared or whatever. And yeah, it's a painless process except for if you have a CT scan with contrast and they stick a relatively wide bore needle in your arm to put the contrast medium in. But yeah, it's no big deal really, unless you have like claustrophobia, in which case again you should say, because I know with some scan machines there are kind of open designs, so you're not put through a narrow tunnel. Yeah, so it's worth asking about that if the thought of being in a narrow tunnel for 20-30 minutes is too much to deal with, then yeah, make sure you talk to the nurses or radiographer about that. Okay, I hope the video was useful. I very much welcome your questions and comments.